25 interesting facts about the coronavirus. Discovered in late 2019, the coronavirus that causes the disease COVID-19 has become a real scourge for all mankind. Now, in 2020, all countries are focused on finding a cure and a vaccine for this scourge. But average citizens can also contribute to the fight by simply following quarantine and self-isolation measures, following all the orders of the authorities and staying at home unnecessarily. Coronavirus facts. Its official name is SARS-CoV-2. And the disease it causes is called COVID-19 according to the international classification. There are actually many coronaviruses, about 4 dozen are now known, as they are a type of ordinary viruses. See 25 interesting facts about viruses. There are many coronavirus genomes, many of which have already been successfully deciphered by scientists. Doctors in different countries are experimenting with various preparations already existing and created to treat other diseases. Some of them may be more or less effective against COVID-19. The most effective measure to contain a coronavirus epidemic is to comply with local government decrees on self-isolation and quarantine. If people stay indoors, the chains of infection are broken. One unaccounted for patient can manage to infect many hundreds or even thousands of people if not detected and isolated in time. A significant number of people carry the disease caused by the new coronavirus in a mild form or without any symptoms at all. The problem is that such an asymptomatic patient does not feel ill himself and does not even suspect that he is infected, while remaining contagious to others. Medical masks do not provide 100% protection, especially outdoors, where they quickly become clogged with dust. But it is still necessary to use them, because it greatly reduces the risk of spreading infection. According to a number of sources, about 80% of those infected with coronavirus carry the disease in a mild form. Treatment of seriously ill patients can take up to a month and a half, so the statistics of cured patients can be rather slow. The SARS-CoV-2 coronavirus spread around the world so quickly for a fairly simple reason. First, it has a fairly long incubation period, on average up to 2 weeks, although there are exceptions. There was information in the Chinese media about a family that lived in the same marketplace that is considered the epicenter of the epidemic in the PRC the whole time Wuhan was under quarantine, and not a single member of that family was infected. There are already patients over 100 years old who have been discharged from hospitals in various countries who have successfully managed to cope with COVID-19 disease. Many scientists from different countries have already conducted research on the coronavirus and confirmed that it is of natural origin and not man-made. Quadcopter drones may be able to help mankind in the fight against the epidemic. Drones can not only monitor the situation on the streets, which is very relevant during quarantine, but also deliver medicines. Trials of the corresponding systems are already underway in various countries. There are many other diseases in the world that are more contagious and more dangerous than COVID-19, which is caused by the coronavirus. When an epidemic broke out in China, the number of people infected doubled about every week. In the DPRK, the coronavirus was banned by order of the authorities, as reported by some media, that is, it was simply forbidden to talk about it. A similar situation was also reported in Turkmenistan, another closed country. At the end of the first quarter of 2020, the coronavirus had already spread throughout the world. It was found even in such a remote piece of land from any continent as Easter Island. See 30 interesting facts about Easter Island. Chinese experts reported that the optimal temperature for the coronavirus is a range of up to 5 to 8 degrees Celsius combined with low humidity. However, at plus 70 degrees, it dies in just 5 minutes, as scientists in Hong Kong found. As we know, viruses need host organisms, but they are capable of surviving for some time beyond their limits. The coronavirus, for example, can survive on some types of surfaces for up to 3 days or more. Approximately 4 out of 5 people infected recover on their own, without any specific treatment. Chlorine dioxide, i.e. the familiar chlorine, reliably disinfects surfaces and destroys the coronavirus. Chinese scientists have found that the new coronavirus is at least 70% similar to the SARS-CoV virus, the same virus that caused the 2002 SARS outbreak in China. The epidemic has had a positive effect on the global environment, as the number of harmful emissions into the atmosphere and the world's oceans has dropped dramatically. But experts believe that after it ends, the consequences could be unfavorable, as all countries will begin to rebuild their affected economies with redoubled vigor.